Where we have Parish President Cynthia Lee Shang updating the public on efforts to fight the coronavirus there.
Good evening. I have with me Dr. Joe Cantor, who is the Assistant State Health Officer for Region 1 Medical Director for the state. Dr. Jerry Satanovich is here, Sheriff Joe Lapinto, Steve Lachute, who is our Chief Operating Officer, Valerie Brulin, who is our Deputy Chief Operating Officer, Joe Valiente, who is our Director of Emergency Management. Where's Joe? Okay. Addie Emsize is our Chief Administrative Assistant, Councilman Scott Walker, and Superintendent Dr. Cade Brumley from our school system. So with that, as of this moment, we have 6 presumptive positive cases in the greater New Orleans area. And those tests are currently on their way to CDC or being tested at CDC at this time. We've spent much of yesterday and today looking at future programming in Jefferson Parish. And in doing so, we are trying to strike a balance between maintaining our quality of life and living our lives, but also recognizing and acknowledging that the virus is present in our community and that we must take the necessary precautions to minimize the spread. Our main mission is to slow the spread. The medical community informs that the most crucial time to minimize the infection rate is to curb it early on. Please know that this is an ever-changing situation, and what I'm telling you today will change as we continue to get more information. And in speaking with members of our medical community, we also have an expectation that the presumptive positive counts will rise as testing becomes more available in the days ahead. In speaking with the governor's office, their Department of Health believe that 80 to 85% of the cases are mild and essentially look like the flu, but 15 to 20% of the cases are quite severe. Experience with this virus has shown that the elderly and those with underlying health conditions are at the greatest risk of suffering the severe consequences of this virus. They don't have a higher chance of contracting the virus, but if they do get the virus, they have a much greater chance of having a severe and very serious case. We have also been informed that for every 1 person that contacts this virus, it can spread to 2 to 3 people. With those facts, our policy as of today will be to suspend all non-essential senior programming of a social nature. We have programming in various departments in our parish. We are an older parish by comparison in this region. Certainly, if you look at the average of our parish across the country, we are considered an older parish. Senior centers operated by our Jefferson Council on Aging and supported by our Citizens Affairs departments have programs. The Golden Age groups operated by our Recreation departments have programs. Our RSVP, our Retired Senior Volunteer programs, operated by our Jeff Cap department, also run programs. So again, all of those programs of a social nature will be suspended until further notice. This does not include essential senior services, such as the Meals on Wheels, medical transportation services. We're certainly fielding a lot of questions recently about the upcoming St. Patrick's Day festivities, the Irish Italian Day festivities. So given that these events are extremely high density, that include thousands of spectators throughout the parade route, moving forward with these parades does not coincide with our efforts to minimize this spread. Therefore, those upcoming parades are canceled, and certainly, and we hope, discussions for having those parades at a later time can be revisited. Again, we're trying to strike the right balance of continuity of our government operations and our daily lives, but yet taking the proper precautions to minimize the spread as it sets foot in our community. And again, it's suspending the social events that include our most vulnerable populations, the elderly, and then doing those things to minimize the number of people infected by looking at the large events, the dense crowds, and considering those factors. Jefferson Parish does not have a public health department. So in Jefferson Parish, we're working very closely with the governor's office of the Louisiana Department of Health, and we're in contact with the local healthcare providers in our community. I have personally had very lengthy conversations with doctors at all of our surrounding major medical institutions, doctors who live here, Their families reside here. I've been on the phone with them, very much so last night and throughout the day. Want to reiterate the importance of engaging in everyday preventive action to minimize the spread of COVID-19. Your staying at home if you're sick is very key to minimizing the spread of this virus. Covering your cough, washing your hands frequently, not touching your face, no close contact, and certainly disinfecting frequently touched surfaces. If you believe you may have the virus, the CDC is recommending that you call ahead to your doctor to help your doctor's office take the steps necessary to protect their staff as well as the other patients in the waiting room. And we will continue to provide updates so citizens can stay informed by paying attention to factual information. We encourage you to check the CDC website, the Louisiana Department of Health website, and to text JP Alert to 888-777. And I can take questions, and certainly Dr. Cantor is here from the state if you have any questions with this regard.